Well, so DHA comes from fish oils, and it now is developed from microalgae, and this is very exciting technology. We talked about COX-2 inhibition with DHA, and again, that there are various diseases that are COX-2 upregulated. So DHA not only plays a role in turning on brain-derived neurotrophic factor, BDNF, but also in COX-2. And again, as talked about, these inflammatory cytokines ultimately, by inducing COX-2 enzyme, initiate what's called inflammation and apoptosis. Apoptosis is where the DNA of a cell is activated to make that cell destroy itself, which isn't necessarily a bad thing. That's how cancer cells are killed, for example. And I throw this at you again. COX-2 relates to cognitive impairment, higher COX-2. So that's how we put out the fire. But let's take a closer look again at this flow diagram. And we notice that if we look at the BDU labeling of dividing cells of mice, I hate these mices to pieces. What's the plural? Mice. If you look at mice who get exercise versus those who do not get exercise, and you look at their hippocampus, you can see that those who exercised had much more replication of cells in their hippocampus. If you exercise, your brain regenerates itself. So they measured BDNF levels in animals that had exercised or those who didn't, and they found, interestingly, that those animals who exercised had more cells developing in their hippocampus and higher levels of brain-derived neurotrophic factor. So rather than tell people they should take a fat-blocking drug, they need to get on the treadmill. Exercise is fundamental. You can't buy it. You know, it's the great equalizer, whether you're a billionaire or not. Anybody can put on a pair of sneakers and get exercise. Exercise improves your brain. It reduces your risk of Alzheimer's. It increases your levels of brain-derived neurotrophic factor. It improves replication of cells in your memory center by exercising. If nurses exercised and they're cognitively tested between 1995 and 2001, and here's what they found. A large study of older women, high levels of long-term regular physical activity, strongly associated with higher levels of cognitive function and less decline. Now, that you can't package. That's not going to be on the evening news. No one's going to advertise exercising. Well, they might, Christy Brinkley might advertise a piece of equipment. But let's call a correlation between our sedentary lifestyles and our risk for Alzheimer's. That's preventive medicine. The higher the activity, the greater the preservation of cognitive function. Not restricted to physical activity that's vigorous. 1.5 hours per week, 20 to 21 minutes per mile. That's pretty slow. Better cognitive performance. A 21-minute mile is not real fast. You could probably walk a mile in about 14 or 15 minutes. I guess a brisk walk. Reminds me of that statement where people say, you should never judge another man until you walk a mile in his shoes. I always think that's a very meaningful statement. You shouldn't judge another man until you've walked a mile in his shoes. The reason for that is when you do judge him, you're a mile away and you have his shoes. What's the time here? Whoa, okay. So again, let's look at the requirement of hippocampal neurogenesis for the behavioral effects of the antidepressants. This is the new and exciting information that's coming to us, that in order for antidepressants to work even, you have to have this regeneration of cells in the hippocampus. Now, you're all probably wondering, gee, maybe I shouldn't be so down on these SSRIs. I'm not going to answer that question for you, but this is the current state of research, and that is that in order in laboratory animals for antidepressants to work, you have to have this regeneration of the hippocampal neurons. And again, when fluoxetine is given, the number of BRDU positive cells in the laboratory animal increases dramatically. So this bromodeoxyuridine labeled cells are cells that are replicating in the hippocampus. That number is increased by giving fluoxetine. It's hard for me to think I'm standing here sounding sort of positive about that intervention, but you know what? I guess it's a holistic approach or a complementary approach. Complementary means we're taking whatever we can put in our toolbox to be effective, whether it's a straightforward pharmaceutical or it's exercise or standing on your head, whatever it may be. I don't call it holistic medicine. We used to say that this is what we do. We do holistic medicine. I didn't know what that meant until I realized that as I got into this, all of my patients had a whole list of complaints. So Interestingly enough, expression of brain-derived neurotrophic factor is the downstream target of antidepressant medication. Recall the flow diagram that I showed you. Neurogenesis in the hippocampus plays a role in mood disorders, that for improvement of mood, you actually need to have this regrowth of neurons. Brain-derived neurotrophic factor plays a critical role in the pathophysiology of mood disorders and in the activity of therapeutic agents in patients with mood disorders. So, how else can we get into that circle of BDNF on the left side and serotonin on the right side? Well, there are various ways. It's why people have improved moods when they exercise. It's why people's moods improve when they take a supplement containing DHA. It's why DHA is now being studied all across various research institutions as a treatment for depression and for bipolar disease. Any way that you can get into that pathway. Caloric restriction. 10% caloric restriction has an important up role in terms of BDNF production. Well, here's an aggressive treatment, I think you'd all agree, to treat depression, right? But yet it works. But if improving depression requires regrowth of cells in the hippocampus, why on earth would we be shocking patients like this? And this has been going on for decades. Well, interestingly enough, we know there's atrophy of the hippocampus in depression. If you're depressed, your hippocampus is smaller than if you're not depressed. Your memory center, your Alzheimer's region of your brain, is more at risk. We know that electroconvulsive therapy, or ECT, is effective in the treatment of depression. And incredibly, electroconvulsive therapy increases the sprouting of neurons in the hippocampus. You can actually shock the hippocampus to life. In the laboratory animal, control versus the bottom, look at the second layer down at the regrowth of neurons and dendrites in laboratory animals treated with chronic electroconvulsive stimulation. Now, I'm not saying that's what we should be doing. If you look at the density of cells in the hippocampus, known as the TIM score, you find that with chronic electroconvulsive therapy, there's a dramatic increase. So any way that we can enter into this cycle, we should consider that. I mean, plenty of people are taking antidepressant medications, but here it seems to me to be a more appropriate way to improve BDNF production, to preserve our brains, to make our brains less susceptible to degeneration and things like Alzheimer's, and actually, since we know that this is related to mood, to improve our moods as well, or improve the moods of the patients who need this. Caloric restriction. And this is kind of interesting information, and it really is important when you think back of the slide I showed you, it seems like many hours ago, of how many calories people are taking in this country these days. Another 2,000 calories a day. When you restrict laboratory mice from calories, in other words, you have one group of mice that's on a specific diet, and the other group of mice has free access to to calories, then those laboratory animals who have high caloric consumption, their brains are less protected against excitotoxic injury and events that directly target the mitochondria. Let's look at it. Remember our model here that we want the mitochondria to work well, so we have adequate ATP production so that we don't have calcium coming in, which damages the mitochondria.